I feel like every day now there's more news about people being unable to afford care. And that's translating not only into less care for pets, which is bad, but also less appointments for the practices and a lot of distress for seeing pets go without care for the veterinary team, because that's why we're in this business, is to care for pets.
Hello, everyone. Welcome back to another episode of VetFolio Voice. This special episode is brought to you by NAVC's advocacy platform, Embrace, and features such a great panel of guests here to talk about the PAW Act, or the People and Animals Wellbeing Act. I was joined by Stephen Feldman of the Human Animal Bond Research Institute, along with Amy St. Arnaud and Dr. Janet Hoy-Gerlach of the Open Door Collective. And together, we explored this important piece of legislation and the meaningful impact it could have on the health of our pets and for us as their human companions. But our conversation went way beyond policy. We also touched on the compelling research that supports what we as veterinary professionals have long understood, that our pets not only offer companionship and emotional support, pet ownership also provides measurable benefits on our mental and physical health. With that in mind, we talked about how improving access to veterinary care has a profound impact on safeguarding not only the health of our pets, but by extension, pet owners and us as veterinary professionals tasked with their care. We'll dive into all the details shortly, but in brief, the PAW Act proposes allowing pet owners to use funds from their health savings or flexible spending accounts toward veterinary care. And this expert panel really helped break down the major impact this could have on access to care, as well as the importance of leaning into creative solutions like this to continue to provide care to more and more pets. Let me tell you a little bit more about my panel guests, and we'll learn more about the PAW Act. Amy St. Arnaud is a leader in the field of veterinary access to care. Amy has worked with national organizations like Best Friends Animal Society, the ASPCA, and PetSmart charities with a focus on building prevention-based models that create real and sustainable change. She helped develop Humane Alliance's training programs and founded Humane Ohio, a nonprofit clinic performing over 18,000 surgeries a year and running a pet food bank for hundreds of clients. Now, as a partner in 2 full-service clinics and co-founder of the Open Door Veterinary Collective, Amy is focused on mentoring others to build financially sustainable practices with a focus on access to care. Dr. Janet Hoy-Gerlach is a licensed clinical social worker and leading advocate for recognizing the role of the human-animal bond in mental health. Her research focuses on the benefits of the human-animal bond and how companion animals support recovery for individuals with mental illness. She helped develop the HARP program at the Toledo Area Humane Society, which places shelter animals as emotional support animals and is one of the few programs of its kind in the country. Dr. Hoy-Gerlach also serves as an expert witness for the U.S. Department of Justice on the therapeutic value of human-animal interaction. She's the co-author of Qualitative Methods for Social Work Practice and is currently co-authoring a second book tackling the implications of human-animal interaction in social work. Stephen Feldman is the president of the Human Animal Bond Research Institute, or HABRI, where he's led efforts to fund over $3 million in scientific research exploring the health benefits of the human-animal bond. He also helped launch the Pet Effect campaign to promote awareness of how pets improve our health and well-being. Prior to joining HABRI, Stephen held leadership roles at Porter Novelli and the American Humane Society, where he oversaw the No Animals Were Harmed program for protecting animals in film and television. He's a frequent speaker and advocate for advancing the science at the intersection of human and animal health. What a great panel. They brought such a well-rounded perspective to this discussion. Let's go ahead and get into it.
Pet parents are looking for a veterinary practitioner who can prove they understand and support the relationship they have with their pet, show you value your client's trust, and earn an official Human-Animal Bond certification from NAVC and HABRI, the Human Animal Bond Research Institute. This certification, appropriate for all members of the healthcare team, explores the scientific benefits for veterinary staff, owners, and animals, and discusses how to establish and promote a strong human-animal bond. Enroll today at vetfolio.com.
I'm thrilled for this episode to, one, be talking about a really important topic, but also to be joined by this fantastic panel of speakers. Thank you, everyone, for joining me. Janet, Amy, Steve, it's a pleasure to have you.
Thank you. It's a pleasure to be here, and thank you for helping to raise awareness of the PAW Act, which, if it's passed, will be such a helpful tool for folks to be able to have a resource for of paying for their vet care.
Yeah. So let's talk a little bit more about that. And actually, before we get fully into the PAW Act, I want to talk a little bit about HABRI, the Human Animal Bond Research Institute. So, Steve, let me hand that over to you. Can you tell us a little bit more about HABRI, what it is, and kind of its role in this legislation?
Well, sure. HABRI is a nonprofit organization. Most of what we do is fund research on the human health benefits of having companion animals in our lives, the mental, physical, and social benefits of having pets. And I think many of your listeners, because they're involved in the veterinary profession, intuitively know this. But what we're doing is we're putting the science behind all of that. And of course, then when you accept that pets are so good for us that they shouldn't be considered a luxury, they should really be considered an equitable right. And anybody who wants a pet should be able to have a pet. Then what follows is we need to make sure that those pets get all the care that they need. So we draw a straight line from research to education and then over to advocacy so that we can make a better world for pets, for people, and everybody who cares for them.
Gee, what comes comes to mind when I'm listening, because I unequivocally agree that just like you said, intuitively knowing how much pets do for us. And I love learning about the science behind it. And so, yeah, I was thinking about the other night when my boxer decided to put her feet on the counter and eat some dinner. And I'm like, oh, definitely the good outweighs the bad, but we have our moments there.
Well, so many people tell us that pets are family. But one of the other things that people always tell us is how much their pets make them laugh. And of
Yes.
course, we know laughter is so good for us. So pets are just so important in our lives.
Absolutely. Absolutely. But, like you said, it's important that when we have pets that they're getting the care that they need, and access to care is an enormous problem. This is something that we know is an issue. And I wish we could solve it just here in our conversation that we're having now, but I think it's probably a little bigger than that. There are ideas, there's options out there to improve care. So from there, let's jump into the PAW Act. Can you talk a little bit about it and maybe give us some examples of the influence that the PAW Act would have, the benefits that it would provide?
Well, sure. One of the things we know, as you said, is that sometimes people have a little bit of a hard time paying for the veterinary care that their pets need. So how do we look for new and novel ways to help people pay for things? And so that's where the PAW Act comes in. It's the People and Animals Wellbeing Act, PAW for short, because we like our acronyms. And what it would do is it would allow us to use our flexible spending accounts or health savings accounts. These are funds that we use where we set aside money, usually through our employer, on a pre-tax basis, so non-taxed income. We set that money aside and then we use it for our own health care or our family's health care. And what the PAW Act would do, it would allow us to use that money for veterinary care. $1,000 for a pet or no limit on how much one could spend for a service animal, and it would just help us make veterinary care a little bit more affordable.
Absolutely. I mean, $1,000 a year can go a long way. And certainly with a service animal, we want to make sure they're not that we don't want every pet getting all the care, but with a service animal, there are some different considerations there. But yeah, even just thinking of $1,000 a year, that can make a huge difference. Along those lines of $1,000 making a huge difference and access to care being a problem, what are some of the challenges that we're currently facing? Amy, I know this is a big talking point for you, something that you speak about quite a bit.
Yeah, well, and even thinking back to your dog getting up on the counter and enjoying food. What if your dog had gotten into a corn cob and all of a sudden you're faced with a foreign body surgery? And those can sometimes run five to $10,000 at the emergency clinic. And so, that is a big problem for a lot of people when you come up with that unexpected expense. And I feel like every day now there's more news about people being unable to afford care. And the most recent PetSmart Charities Gallup poll really hit me. The 52% of people have not brought their pet to the veterinarian within the past year, even when they felt that their pet needed care, or they've ended up declining care that was recommended. And that's translating not only into less care for pets, which is bad, but also less appointments for the practices and a lot of distress for seeing pets go without care for the veterinary team, because that's why we're in this business, is to care for pets. And I think the big one that really hit me, and the reason is that I think the PAW Act is so timely and so important, is 73% of pet parents who decline this care due to affordability say that they weren't offered a more financially attainable option. So, talking about what this could do by adding another $1,000 on is really important, to add options to what we can provide.
I'm curious, and I know we don't have time to cover it here, about people saying they weren't being offered another affordable option. I would imagine there's some communication, maybe barriers, or someone thinks they're saying one thing, but the message isn't coming across. That's probably a whole nother conversation when we're talking about access to care, is making sure that we're communicating all of the options to clients, and certainly saying, oh, here's an extra way that you can help pay for your pet's care would be a big one to include there. So it seems like sort of an obvious question of, why is taking care of our pets important? But Janet, can you talk about that a little bit? Just thinking about, of course, it's important for our pets. All the things that you talked about, Amy, moral injury and things like that when we see pets go without care. But what about the impact on human physical and psychological health as well?
Yeah, thank you for asking that question. That's a critical piece that really just elevates how important this legislation is. Of course, as you said, first and foremost, it's important because our pets matter in and of themselves. And shout out to all the veterinary staff out there for helping us to take such good care of them, because for so many of us, they're our family members and or best friends. There's an ever-growing body of peer-reviewed research with findings showing how pets can play a significant role in our own physical, social, psychological, and emotional health. Just as an example, like I said, it's been growing over time. So in 2013, the American Heart Association, so this is the biggest national public facing organization for cardiologists. They're hardcore about, the level of evidence they require. They published a white paper in 2013 summarizing cardiovascular benefits. So, things around blood pressure, heart, respiration rates, and then overall, you know, different kinds of cardiovascular heart measures. And they concluded then that living with pet, particularly dog, had a protective effect. They then reviewed research for another 10 years. In 2023, the American Heart Association launched a national human public health campaign called Healthy Bond for Life, based on the research that's accumulated. And the physical benefits, of course, there's what we think of being active, walking our dog or playing with our animal, that kind of thing. But there's also the contacted related benefits, which are associated with the release of oxytocin. That's the bonding hormone in our body, which then causes a trifecta of good stuff. Our heart rate, our respiration rate, our blood pressure all slow. And that actually happens with the animal too. And so if we think about what our stress response is as human mammals, if we looked up the symptoms of a panic attack, almost all of them are physical and related to heart, breathing, a number of physical things. That contact with our pets can help offset our stress responses. And over time, that helps protect our health. There, of course, social benefits like reducing loneliness, and then the psychological and emotional, the comfort, the affection, supporting mental health, and even protecting against suicidality. That's actually how I came to focus on this work as a social worker, was doing human risk assessments. And one of the questions we ask is, what's stopped you up until now from acting on your suicidal thoughts, your plan? And we got the usual protective factors, people's family members, their friends, their faith, thinking it was wrong, but also on a regular basis were people saying they could not leave their pets. So when someone can't get care for their pet, it's not just the animal who may suffer. It, deeply can affect the human well-being as well. And that's what makes this more than, a personal issue accessing care for, an individual's animal. As Steve put it, this is a human public health issue, for human and animal well-being. And this PAW Act is a tool to help support both kinds of well-being for us. It opens the
Absolutely.
door to that.
Absolutely. And whenever I hear it, I mean, it's kind of like we've talked about before that, kind of intuitively in the animal care industry, we recognize these things because we experience them so deeply. But to hear the published research and the experiences that people interacting with animals are having outside of, say, the animal care industry, it's, I don't, it's so many things. It's so validating of things that we know are so important. And I don't know, I'm just always taken aback by how amazing animals are, of just giving us a reason to get
Yes.
up and keep going and do things when things get tough, and to be there for us at the end of the day when things have, when things are hard and confusing and whatever we may be experiencing, or if they're happy and you want to go for a run and go play in the yard and all that as well, of course. And along those lines, thinking about this from an animal care professional perspective, Amy, you mentioned that it creates a lot of distress for the veterinary team as well when animals can't get the care that they need. So I would imagine that thinking about the PAW Act, this tool that I think is a great word for it, Janet, to increase access to care. What kind of impact do you foresee on veterinary professionals with this act?
So much because we talk about moral distress, and that really means that you have the skills to be able to help that pet, but you're unable to for reasons like money. So with this, veterinary professionals are very good at being able to offer a variety of options when finances are limited, but sometimes you hit situations where you just can't go any further without additional funds. So knowing that a client can access up to $1,000 allows us to do the exam, do the diagnostics, and figure out a plan together. So it's strengthening that relationship, and we're feeling like partners in care together, like that we've got you. We're going to figure this out. And I think the important part here is that we can combine this option with other options. So if you know that you're going to be able to have that $1,000 or up to $1,000, and then you can also offer a pay over time plan, or they've also got pet insurance, we can stretch that care even further. And it's such a unique yet simple way to use something that already exists. It's not going to cost the practice, but it's going to greatly expand access.
Absolutely. And I think we've all experienced that at some point or another, to say, like you said, we have the skills, we have the resources, but we just can't go any further without having the funding. And yeah, that makes a really tough day for everybody involved. Janet, did you want to add to that?
I don't think I could say that any better. As from a mental health clinician perspective, and veterinary social worker, I want to add, the PAW Act is also a way to help support the mental health of veterinary staff. Occupationally speaking, veterinary staff and animal welfare staff are at a much higher risk of burnout, compassion fatigue, as Amy said, moral injury, mental and physical health issues related to chronic stress exposure, much higher risk than the general population. And that this is at the occupational level. So this isn't a individual veterinary person issue. This is, looking at big aggregate studies. And as Amy, said, that the financial barriers to that block, veterinary folks from you all from providing what you've trained to do and dedicated, big part of your life to doing, that can be rough. And then also having to have the conversation, where your client is struggling with a financial barrier, that wear and tear on people, the vets as well as the clients is another, I guess, human benefit dimension of this PAW Act.
Yeah,
One more tool to
absolutely.
help reduce that pressure for, profession where there's already a great deal. Better for the pet, better for the human client, and better for the veterinary team.
No doubt about it. And I'm so glad that you bring that up because that has been a big topic of conversation of, compassion fatigue and moral injury and burnout in veterinary medicine. And yeah, I'm here to tell you firsthand. And I think
Mm,
many of us have experienced it that having those conversations is incredibly hard and can really kind of cast a cloud over your day and what's
yeah,
going on. And that can be
yeah,
really challenging. So a tool to benefit animal health. As you've pointed out here, all the benefits that animals have on human health, and so of course benefit pet owners. But it also sounds like it has the potential to have a major impact on veterinary teams as well.
yeah, yeah. One more resource that can help reduce, the pressures around the financial barriers
Yeah,
to being able to provide care.
absolutely, absolutely. I'm so glad you brought that up. Amy, I want to jump back over to you for just a minute because you started to talk about some other tools that we have available for helping with access to care. Can you elaborate on those a little bit more?
Yeah. So one big challenge in vet med has been that we've had traditional options of pet insurance and credit-based financing. And those are both important tools. But if a client doesn't have or can't afford insurance or doesn't qualify for credit-based options, there haven't been a lot of other options for the client or the team. Other than, well, the practice could heavily discount the services, and that's not a sustainable option. So when we offer what we like to call a spectrum of payment options, like when we talk about spectrum of care, we offer a spectrum of payment options that hopefully can greatly increase clients accepting our treatment plans. So we like to have kind of an all of the above option for start with pet insurance, but now imagine we can utilize that HSA or that FSA as an option as well, and we can offer pay over time plans. And you and I, Dr. Cassie, have had a great conversation about this in the past. We're not talking about the in-house plans that you're trying to do yourself with the hassle of dealing with administration and collection. We're talking about third party managed plans. So you can still offer the option, but without the hassle. And then using an angel fund, having a partnership with nonprofits who can provide subsidies or grants. So when you have all of these options in your toolkit, now your veterinary team can easily connect the client with the right option for them or be able to combine options. So what I love about this with Habry thinking about this with the PAW Act is it's so outside the box, but it's such a great tool for us to add in. And it also really opens up the conversation for what else could we add in? What other tools have we not traditionally thought of that could be brought in outside of vet med and utilized in? So I love that we're thinking in this whole other direction instead of just saying, well, payment due at the time of service, that's it, we can't help you. Let's really look at what are some other unique options.
I love that. I love that. And it goes back, Steve, to what you said about, animals not necessarily being a luxury, that people should be able to have animals and be able to take care of them. And we're an industry of very creative individuals. We come up with some pretty interesting ideas. And yeah, Amy, to your point, to say what else is there? What else can we do to help benefit access to care for all of the reasons that we've talked about here?
So, I love this conversation because it highlights for me that veterinarians are the guardians of the human-animal bond. They're right at the center of this discussion. So, in the exam room, every day in the clinic, you're protecting the bond, you're strengthening the bond, you're making it so that people can really enjoy good health at both ends of the leash. And so, with veterinarians doing so much, I hesitate to ask you to do one more thing, But I do want to ask one more thing, which is that, you're the protectors of the bond and you're the experts and people will listen. So I really want to ask veterinarians to get involved on this issue and really reach out to members of Congress, to lawmakers, and express your support for the bill because just as everyone relies on veterinarians to care for our animals, I think they're going to rely on you for your expertise on this issue.
Yes, exactly. Like you said, we are a field of creative individuals. We are also a field of very busy individuals. So let's talk about how we can support the PAW Act. And I'm happy to throw out there that we try to make it easy here at NAVC to learn about initiatives like this and to support them. So there's certainly navc.com/embrace. But Steve, can you talk a little bit about the impact that reaching out through a platform like Embrace and getting in touch with our Congresspeople about this can have?
Sure. So I think some of us remember our civics lessons or about how a bill becomes a law,
Schoolhouse Rock.
right? Schoolhouse Rock. And so we're at the phase right now where we're building co-sponsorship for the bill. We're asking members of Congress from across the country to attach their name to support the People and Animals Wellbeing Act. For everyone who's really into this stuff, it's HR 1842, and you can actually read the bill if you go to congress.gov and search HR 1842 in the 119th Congress, which is where we are now. You can read the text of the bill. I also want to point out it's bipartisan. Uh, pets are pets are not one party or the other. I always say they're nonpartisan. Everybody loves pets. It's one of those common things that everyone agrees on Capitol Hill. We just need to spread the word. So the idea is to ask your member of Congress to co-sponsor the PAW Act, and then when we build that support, then hopefully we can either pass it as a standalone bill or maybe sometimes it can get attached to a larger piece of legislation. But we have to keep working at it and raise awareness.
There's so much to consider at any given moment, and so like you said, attaching our names to it, raising awareness, letting our representatives know that this is something that is important and that we want to see go through, especially something that's a nonpartisan issue that can hopefully create so much benefit for everyone involved with, I don't know, very little downside. Maybe I'm biased when I say that, but I'm going, doesn't everybody win here?
Well, and I just want to say, the North American veterinary community not only brings everyone VetFolio, but also brings everyone NAVC Embrace, which makes it really easy to connect with your members of Congress. You can go there. All you got to do is put in your zip code, and you can figure out who your member of Congress is if you don't know already. And then there's a sample letter that you can customize for yourself or use it as is and be able to send that electronically right to your member of Congress. So um, the the NAVC is not only a great partner of HABRI, but a great partner for every veterinarian out there to get involved in this issue.
Oh, well, thank you so much for saying that. I know our Embrace team works really hard to try to make it easy to understand and take action on these initiatives. And on that note, I want to thank all three of you for being a part of this discussion. Really important topic, and I think you've just done a fantastic job of explaining the issue itself and then the importance that it has. Are there any final thoughts you want to share?
I was just gonna say, Steve got me so excited. I feel like I'm ready to run out right now and get my,
Yes.
to get mine written and to call my representative. But I also want to encourage practice owners, practice managers,
Yes.
anybody, vet techs, vet assistants, anybody who's working in the veterinary field who's going to see the benefit from this should also be contacting. So the entire team is really going to benefit from this.
Yes, I was thinking along similar lines, maybe even a little broader. Ultimately, this is giving all of us, any of us who have access to, a health savings account or, something that falls under PAW, more autonomy, more self-determination over what we can do with our money. There's restrictions. This is broadening that so that we can use the money to meet our family's health needs, including our animal family members. And we work hard for our money. So it's good. It's good that, we're the best judges of how that can be spent. And I think having this, opportunity to give us more autonomy about that is critical. And so I think any of us who live with pets or might live with pets, that this is an important issue to support. And as was mentioned, it's bipartisan and not much of a downside.
Absolutely. Steve, do you want to throw anything else in there? I mean, Amy and Janet, you guys summed it up so well.
Well, I think this is something that most pet owners would get excited about as well. So I would encourage everyone to spread the word, to the clients and the people and friends and neighbors and people in the community who you work with. People with disabilities who might rely on a service animal can really benefit from this, having an extra way to cover the care for those important companions. So I would say spread the word beyond the clinic walls.
Absolutely. Absolutely. I feel like that's the perfect note to wrap up on of spread the word and let everybody know about the benefits that this can provide for everyone involved. So again, a big thank you to all of you for joining me. This has been a really great and really important conversation.
Thank
Great
you
to
so
be
much.
with you. Thanks.
Thank you.
I want to say a huge thank you to our panel of speakers. This was a great discussion full of really helpful information, and I want to say thank you to all of you for breaking this bill down in such an easy to understand way, and also really presenting a powerful case for the importance of this type of legislation. And to all of you who joined us, thank you again for listening to this special edition podcast from NAVC's VetFolio and NAVC Embrace. As a community, we need your voice to be heard so together we can make a difference. To ask your elected leaders in Congress to support the PAW Act, please visit navc.com/embrace and take action. While you're there, you can become an advocate and support other important issues affecting animal health. Thank you again for listening, and as always, visit us on vetfolio.com for all of your veterinary education needs. If you enjoyed this podcast, please, we'd love it if you'd leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other great content we try to put out there. As always, we'd love to hear your input on what you'd like to hear next, so feel free to reach out to me at dvm@vetfolio.com. We could also connect on Facebook at Dr. Cassie DVM, or you can find me on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.